Hello and welcome back to Karisu. Today we're going to be talking about Hyperemesis Gravidarum. We all know that pregnant women tend to have morning sickness, and we just call this as vomiting in pregnancy. But then the thing that we don't know is there are two kinds of vomiting in pregnancy: simple vomiting and severe vomiting. Simple vomiting is what we call as morning sickness. It's because of changes in hormones in our body, altered immunological states, and usually it will go away in 12 to 14 weeks. Even if you go to a doctor also, mostly they'll just give reassurance, some vitamin supplements. Only if the vomiting is slightly severe, then they'll give you some medication to control the vomiting. But then there's a second kind, severe vomiting, which is the topic of our title today, Hyperemesis Gravidarum. This isn't just normal vomiting which happens in pregnancy. This is very, very bad vomiting to the extent where it becomes harmful to the mother's health. And the vomiting can become so bad that it can incapacitate the mother, meaning she can't do what she usually does. Her normal routines can't be done because the vomiting is continuous and it's a lot and all the time. Who can be affected by Hyperemesis Gravidarum? I can't tell you for sure that this person will get and this person won't get, because that's not how it works. But there are certain risk factors, meaning if you have these criteria, the chances of you getting Hyperemesis Gravidarum is higher than if you don't have these criteria. Example of those criteria are either it's the first trimester of your pregnancy, or it's your first pregnancy altogether, or if you have low body weight, if the mother is of a very young age, or if you have history of motion sickness or migraine before you got pregnant. So if you have these criteria, the chances of you getting Hyperemesis Gravidarum are higher compared to someone who don't have these criteria. If you're wondering what's so bad about vomiting, well, it is bad because severe vomiting can lead to dehydration. Changes in the body's electrolytes can be either acidosis or alkalosis, and in very severe cases, weight loss and starvation. Usually the fetus is not affected in this condition, but if Hyperemesis Gravidarum is not monitored properly and it's not controlled properly, it still poses a risk to premature delivery and underweight babies. What can you do if you already have Hyperemesis Gravidarum? Well, the first and most important thing is to consult with your doctor. Listen to their advice, follow their plans, follow your medication, don't skip your medication. All these are very important things. But then minor changes which you can do to make life slightly better involves your diet. What I can suggest is take dry carbohydrates, meaning either biscuits or breads. Avoid oily foods and avoid any food which you were already nauseated towards before you got pregnant. This will just make it worse. And your food intake, try not to take the normal 3 or 4 meals we take in a day. Divide it up, take small portions but eat more frequently, every 2 hours or 3 hours once, so you'll get like 5 to 8 meals a day. This would hopefully make the condition more tolerable. If you enjoyed this video, you found this video valuable, or if you learned any one thing from this video, all I ask you is please share the video with your friends or family members. Spread the knowledge. And until the next informative video, in anything you do, do your best and be the best version of yourself. Bye bye.